Good afternoon, everyone. I hope everyone is well. We'll get started in about 2 to 3 minutes. And for those elected officials who are part of the Broward delegation, if you can just maybe send Andrea your number so she can know that you're on the line.
You are unmuted.
Good afternoon. This is Broward County Delegation Chair, State Representative Shevrin Jones. First, I want to thank everyone for joining us on the phone today. My first encouragement is for everyone to, if you can, to please mute your phone until those on the agenda have completed their presentation. I do want to say, while I wish this were under different circumstances, it is definitely critically important for all of us to stay in communication with one another throughout this rapidly evolving public health crisis. I know I speak for not only my own family, neighbors, and the broader community when I say that anxiety is high for Floridians and Americans from coast to coast as we grapple with the coronavirus pandemic. There is no question that many people here in Broward County are rightfully concerned about preparedness and response, which is why the Broward delegation requested this teleconference between state and local officials and leaders in the public health space. Today, we will hear from representatives from local leaders from Broward Health. We will hear from Memorial Healthcare and Baptist Health. And I'm apologizing now as our participant from the Florida.
This meeting is being recorded.
The participant from the Florida Department of Health unfortunately could not make the call. At a later point in time within the conversation, we will hear from the Florida Division of Emergency Management Director, Jared Moskowitz. We will also hear from Deputy Chief of Staff to Governor DeSantis Adrian Lukas. We will also hear from a representative from the League of Cities and other municipal officials who will be on the line. Following that discussion, we will take questions from the media. So I think right now my ask is that everyone can mute their phone. If everyone can mute their phone, if possible. Appreciate it. Say it again. Okay. So at this time, I'm going to move forward. I'm going to see if Vice Chair Perry Thurston, if there's anything he would like to say before we get started. Senator Thurston, are you there?
Yes, I am.
Okay.
And I just want to take this opportunity to thank you, Chairman, for calling together all of the leaders across the state to have this discussion, especially in light of the fact that Broward County now has more known cases than any other county in the state of Florida. So I'm looking forward to hearing what everyone has to say. But I'm also thankful, I've been following this, and I think that the coordination across the state and across our county has been remarkable. I would say in the Tri-County area. But certainly I just want to thank you for calling this together. I, as well as all of our residents, are concerned about the numbers here in Broward County. I look forward to this conversation. Thank you all very much.
Thank you so much, Senator Thurston. Very much appreciated. For those who are entering the call, for those members who might be on the call, if you could just let Andrea know that you're on the call, that would be very helpful, so she could know just in case we need to buzz you in for you, so you can ask questions. Since we're going to wait for.
And Mr. Chair, this is Vice Mayor Steve Geller. I am on the line as well.
Oh, please, would you like, go ahead, Vice Mayor Geller. You definitely go ahead if you would like to acknowledge the call.
No, actually, I have very little to say. I'm very interested in listening. I did want to, again, thank you for scheduling this. I don't know if there's anybody from the governor's office on, I've been in frequent communication with Bertha Henry, and she's been telling us about the great cooperation that we've been receiving, particularly from Shane Strum and the governor's office. And as we all know, Shane is one of us from here in Broward, the governor's chief of staff, and I understand he's been doing a bang-up job helping us.
Yeah, and I appreciate that, Vice Mayor Geller, and I'm happy you just did that lead in. And I want to see if Deputy Chief of Staff to the Governor, Adrian Lukas. Mr. Lukas, are you on? Mr. Lukas?
Hey, Representative, this is Adrian Lukas from the governor's office. How are you?
Thank you so much, Adrian. I'm doing well. So, Adrian, we're going to open up the floor to you and allow you to go ahead and give us the update. And we will is your show. Thank you so much.
Thank you all so much for jumping on the call. As was just said by the Vice Mayor, we've been in close contact with both business and local officials in Broward constantly. As you said, the staff is a Broward guy, so I know it's the response to your community is holds of course a special place and in part as it does with Director Moskowitz. Really our message, and we're running pretty quickly here. We're constantly on the phone, talking with whoever really needs anything. At the end of the call, I can offer my cell phone number. Happy to connect with all of you. But our message right now and our main focus is, of course, the elderly population. It's in terms of social distancing and ensuring that community is appropriately cared for and is following appropriate protocols is essential. I know Secretary Mayhew has been her team has been making phone calls constantly to nursing homes, ALS, and the like throughout the state every day. I know that they're making also in-person visits. As of yesterday, I didn't get the numbers today, but I know they visited over 300 of these facilities, and that's ongoing. Of course, there's a lot of new items coming out from CDC. I know we're going to be releasing some more guidance on the restaurants and hotels. I know that local communities are really, thirsting for more direction in that regard. So we'll do our best to be kind of consistent in that messaging. The newest kind of update on our end, we just rolled out a new website. We're gonna be doing twice a day updates, the official state update. In the last few days, as you all probably know, a lot of private testing labs have come online. So as we've transitioned to kind of the higher volume, we think it's more prudent to have a twice daily official update. There will be now more and more stories, and you guys will be hearing of cases popping up throughout the state. That's because private labs send text messages to the individuals that they test. So we think the most organized format to do this is to provide the two updates. Like I said, I'm available and our entire staff is available. We're going to do everything we can to support you. To the extent you all have needs and supplies, please make sure that's run up through to Jared Moskowitz's team at the Division of Emergency Management. He's been doing a great job making sure to order and fuss up all of the things that we think we expect to need as the numbers inevitably increase. So that's kind of all I got for now. I really appreciate you guys putting the call together, and we'll continue doing our best to provide you support. Just let us know what you need.
Thank you so much, Adrian. And we're going to go to questions at the end. So I'm sure some people might have some questions for you. But will you be able to hold on till we get to the questions and answers part?
I have a call in about 1 minute, so I am happy to take one. But if you do need me, you can reach me on my cell phone.
Okay.
I'm happy to provide that now.
This is Ben Conner from Miami Herald. I get a quick one in on this drive-through testing we're hearing about in Broward County. Is that connected to the HHS effort that we heard about yesterday, or is that a state effort and separate from the HHS effort?
No, sir, that's separate. We are in close contact with HHS, but this is a public-private partnership. We wanted to move quickly, particularly in the Broward area, as the numbers increase. So, fortunately, Memorial was well positioned. They had a good infrastructure, good materials on hand, and we think that will be a good first site.
the governor mentioned in his press conference yesterday that, we didn't say a specific date is going to be stood up. We're going to do it as fast as possible, but we want to get it right because we know other states have had some difficulty. So we're working hard to get that done. I know, our National Guard will be assisting us, as will staff and that memorial has on hand already.
This is Senator Gary Farmer. Very quickly, I know you got to get on another call. I think we're all concerned about the availability of tests. We appreciate the move to drive-through testing. That's very prudent and has been successful elsewhere. Hoping, though, that you can set up multiple locations for drive-through testing and asking what the plan is for determining whether a test is administered. Are you going to confirm that people have symptoms before you administer the test, or are you going to test everybody who asks for to be tested?
Thank you, Senator, for the question. I can't confirm how we're going to limit it. There will have to be a way to limit the testing in some way, but I will let you know. I'll connect with you offline as soon as I know. DOH is kind of determining that in conjunction with Memorial and other kind of experts in the field to see what is the way, at least right now, will evolve, but what's the way we can test the most people while maintaining our supplies and being able to respond to needs throughout the state.
This is Representative Joe Geller.
Thank you.
You do that offline, but all of us are interested, so find a way to get us all that answer, please.
Representative Stark wants to know.
Yes, sir. We'll provide that publicly as soon as we know.
So members, I know a lot of members have questions. So especially for Adrian. So Adrian, what we'll do is I'll get with Andrea to see if Andrea could be sure that we get the information on how people can and will be tested. Is that okay? Mr. Lukas?
That works, Representative. I do got to jump off.
Okay, no problem.
Putting the call together.
No problem.
Thank you, sir.
Okay, no problem. Now at this time, we'll go with Baptist Health, Kate Goldman and Don White. Kate or Don, are you? Oh, go ahead, Kate. Yes?
This is Dawn White. How are you?
Hey, Don, how are you? The floor is yours. This is Don White from Baptist Health, everyone.
Essentially, our message is, as much as possible, we are suggesting that the public use our Care on Demand platform, which is our telemedicine platform. We are experiencing extended waits of up to 90 minutes, but this does provide the public a very safe, secure, from their home or in the privacy of whatever space they are in, the ability to discuss directly with a caregiver what their symptoms are, and then they will be directed from there based on the symptomology and the CDC guidelines, whether or not they need to go further into a testing status. We are short of a reagent that we need to begin to test locally. We're working with State DOH and the emergency management, FEMA, in regard to getting that reagent. But otherwise, that's my report. Happy to answer any questions.
Does anybody have any questions for Don White from Baptist Health?
Is there any idea when that reagent might be coming, Ms. White?
No, it is. I don't have an update today. We ordered it late last week. It is back ordered. It's not that it's not being produced. It's back ordered, but no, I don't have an update yet.
Is it effective start? How significant a shortfall is it, and how are you testing people now?
No, we're not testing people now. We haven't been testing people, and it's not a shortfall. This is a requirement that we have based on now having the ability to test, having test kits, but there's a number of steps to the testing. And so as we begin to start using test kits that were sent from the state in our lab at Miami Cancer Institute, this is part of the process that we need. It's called a reagent. And so we are looking for that reagent. We're using all of sources available to us. And as soon as we have that reagent and can begin to run the test and be approved and certified to run the test, then we'll start testing.
This is Vice Mayor Geller. My understanding there's a national shortage on that reagent or comparable reagents. Is that accurate? And if so, do you have confidence that you'll be getting it soon?
I don't have that information. I understand from a call I was on earlier, and maybe the representative from Memorial, I believe also they are looking for the reagent. I believe there may be various reagents depending on your equipment. But I don't have knowledge on national side.
Thank you.
Representative Stark, telemedicine?
Representative Starr, you have is your question about telemedicine?
Yes, my question was, are they set up for telemedicine with any kind of an app?
I believe you can answer, Ms. White.
Yeah. Yes. Baptist On Demand, Care on Demand is the name of our app. You can download the app, and yes, it is accessible. We've been getting very high marks in terms of the public in terms of their experience. Again, wait time would be longer than we'd like to see prior to the circumstances we're in. But yes, it's available now. You can download it. Baptist Health Care on Demand.
Okay, and so Ms. White, is that something that we can tell to our constituents that they can download the Baptist On Demand app and they will be able to speak with a doctor right there to share their symptoms?
Absolutely, they can. We will send you a flyer that we are sharing. You can share it with anybody you'd like. We've actually waived any applicable fee for the visit. So, and that'll be on the flyer. It's code 19. We'll give you that, and it's we have a broad array of caregivers ready to answer any questions, and again, go through CDC guidelines and symptomology.
That's perfect. Thank you so much, Ms. White. Really appreciate it. At this time, we're going to have Broward Health CEO Gino Santorio. Gino, are you there?
I'm here. Can you hear me?
We can hear you. Go ahead, Gino. The floor is yours.
Good afternoon. Thank you so much. Thanks for putting this together. Right now, kind of echoing what some of the others have said, we're monitoring the situation as it's fluid, but we have been able to successfully plan in terms of stockpiling supplies and working with additional vendors out there to get supplies in that are needed. As far as the triaging is going, what we've done here to take additional precautions is we're setting up triaging outside in separate air-conditioned tents so that we can isolate any potential patients that need to be tested. We're also working on, Senator Farmer, I know you brought up additional sites. I've spoken to the governor yesterday and told him our plans to set up an additional site over here to collect testing specimens so that we could send out. So hopefully that will be up in the next week or so. We are just pulling those plans together now. As far as testing protocols, we are following the Department of Health protocol tree, which actually is pretty nice to follow. I and the rest of the health system has been referring patients that are questioning whether or not they should get tested or go in to that tree. It's a decision tree. It tells you, should you go to DOH for testing? Should you follow up with a primary care physician for testing at a commercial lab? So that's very helpful. I will say, and I've spoken to several CEOs around the state, when we heard that schools were closing, we were all very worried, I will say, in terms of our availability to maintain staffing levels. And I will say I'm once again pleasantly surprised with the healthcare employees' ability to rise to the occasion. We're close-knit family here, and they've been able to work with each other and find alternative arrangements for their children. I can appreciate that as a new dad myself. Want to ensure that, but we have had very little call-outs today. In fact, clinical call-outs at our North facility, we've had 0. So we're in good shape there. And just continuing to monitor the situation. We went to a remote work site for all employees that could do that, purchase some additional IT equipment so that we can outfit our employees with that. And those individuals are working from home starting today.
Well,
Patricia Williams, Gino, thank you for joining us. You stated about additional sites over here. Where is over here?
Yeah, so the one site right now that is being set up that was announced yesterday with the Memorial Partnership, and there may be more through that partnership, but that site, I believe, is going to be closer to Memorial West. So we wanted to establish a site on this side. We figured the equidistance between where that is and the site that we should place so that there's basically the shortest distance for all people in the county to get to one of those sites would be actually somewhere near the Pompano Beach, Fort Lauderdale area on the east side. So we're targeting a couple different sites right now. Working with Sheriff Tony, had a call with him earlier today to help with the security detailing of it, and he was very accommodating with that. So it will be on this side somewhere. We have 2 sites that we're looking at, but generally around the Commercial Boulevard area.
I got my phone.
Hey, Gino, this is Chip LaMarca.
Hi, Representative Marcus.
Just a suggestion, maybe while you're doing that, because I just know where Rep. Williams is going, possibly the west side of the Pompano City Center. I believe that Macy's is closing, and there is a very large parking lot there, and that's near Broward Health North. Not sure if that fits into what you're looking for, but just a suggestion.
Thank you very much. I will look that up as well to see who owns that and see if we can't get on there.
Any more members have questions?
Just let me know.
Okay. Thank you, Representative
Thank you so
Williams.
much, Representative Williams. I appreciate it.
Are there any other members to the media? We're going to hold your questions until the end, but are there any other members, senators, or representatives who have questions for Gino?
Mr. Chair, may I ask a question, please?
Yes, please, Representative. Yeah.
Sharon Pritchett.
Yes, go ahead, Representative Pritchett. You're recognized.
Yes, sir. Thank you so very much. And first of all, good afternoon to all of us in our efforts to work collectively as a unit. Thank you for being a part of this call. I'd like to know if there will be printed resources regarding the nexus of this conversation so we can try to get that information out into the various communities, please.
Thank you. Go ahead. Representative Pritchett, is that for the entire body?
Well, yes, any helpful information we may be afforded.
Yes.
To help get some information out that's written.
Yes.
Would be helpful.
Yes, and Representative Pritchett, so I think Andrea is on the call and they're taking notes. And so once we are able to compile the information, I know Ms. White said she had some stuff, and I'm sure Broward Health has some information, and any other information that's collected here. Andrea is going to send it out to all the delegation members so you can dispense it to your constituents. Does that sound okay?
Yes, sir. Thank you very much, Mr. Chair, and thanks to everyone else.
Thank you, Representative
And I
Pritchett.
have a question, Mr. Chair. It's Representative Freud.
Oh, go ahead, Representative Armfroy. You recognize.
I received an email yesterday from one of my cities, the city of North Lauderdale, in reference to their concerns with getting resources. They have no Tyvek suits. I'm not sure how this process is working on the city end, but how is that working? Are you getting the things that you need? Because what I heard from the state was that the city has to make a reference to request to the county. County would get information up to the state. How are we doing with the Tyvek suits, sir? Gino?
So as far, are you talking about for the personal protective equipment?
For our firefighters and our first responders.
Okay, so for that, Representative, I'm not sure how that's being doled out. As far as the PPE, the only supplies that we're dealing with are directly for the health system. I do know that I've been on some of the DOH statewide phone calls, and they have asked if anyone is coming up on shortages, for them to notify them, because they do have a state stockpile as well. I'm not familiar enough with their ability. What I will have our emergency management.
Sorry, that question was not for you. That was for my county. If there was any county officials on the line, I'm sorry, that was not for you.
This is Vice Mayor Geller. I'm not aware that I can check with Ms. Henry. I'm not aware that the county would be providing these types of emergency suits.
No, they're not saying the county is providing the suits. I heard that the cities have to make the request to the county, and then the county makes the request to the state, similar to when hurricanes. So I wanted to know how that process is working, because my city is not receiving, they have not gotten any feedback into whether or not they will receive these Tyvek suits, and this is for our first responders.
I am not familiar with that, but I will check with the county administrator as soon as the squall is over, and I will contact, I guess, Chairman Jones for distribution.
Thank you.
Thank you so much, sir. I really appreciate it, Vice Mayor Geller.
Hey, Chev, I have a question. This is Mike Gottlieb.
Hey, go ahead, Representative Gottlieb. You're recognized.
So, thank you, sir. I've had some elderly communities in my neighborhood reach out and ask how they can get food deliveries, or for people. Just, food deliveries for elderly is basically the concern. Is anybody doing anything to help take care of that?
Is there anyone on the call who can answer Representative Gottlieb's question about our elderly community when it comes to food distribution?
Sir,
Yes.
this is Jessica with Rep. Jones' office, and I have some information regarding that. Give me 1 second. I spoke with Charlotte Mather-Taylor from Aging and Disability Resource Center in Broward, and she is coordinating with Mayor Josh Levy from City of Hollywood, and they've had conversations with the Department of Elder Affairs, and there's generous local companies who are willing to provide funding to help seniors who are not currently receiving meals under the Older Americans Act to provide meals to seniors in Broward County communities who are food insecure. And so if there's an elected official who has a constituent in need of food, we can email Charlotte Mather-Taylor the information regarding the senior, or have the senior call the helpline. I can provide that number. It's 954-745-9779. I can say that again, but I can email it all this information to anybody who wants it.
Jessica, Jessica, was there? You said there was a phone number that was given.
Yes.
I'm here.
The senior can call the helpline at 954-745-9779. Or they can email Charlotte Mather-Taylor,
Okay.
but I can provide that email address at a later time.
Okay.
Yeah, and I can provide any information on senior resources and all the vendors with Meals on Wheels and whatnot. Thank you.
Representative Gottlieb, thank you, Jessica. Representative Gottlieb, does that answer your question?
Yes, it does. Thank you very much.
Oh, thank you. And for those who need the number, once again, so if there is someone elder in your community who may need food, that number is 954-745-9779. If there are no other questions, yes. Who is this?
This is Vice Mayor Brian Johnson.
Oh, hey, Vice Mayor Johnson.
Yeah, I want to address that issue as well as one of the elderly ADRC providers. So one of the recommendations I will make to those who are assessing the needs of their constituents is ask those constituents to advise if they have storage capacity for up to 2 weeks worth of meals, because that's what the delivery quantity is likely to be. And these meals have to stay frozen to be healthy. And we don't want to take for granted that people actually have freezer capacity. So we should probably be asking that question so that we can relay that information to ADRC.
Oh, thank you so much, Vice Mayor Johnson. Really appreciate that.
Representative Stark, I got a question to ask.
Go ahead, Rep. Stark. You recognize.
All right, thank you. And our folks that were there, they were answering questions about services for the elderly. We're talking about food, but I know that there are a lot of seniors. They get even minor symptoms. They're already worried because they're at risk, and they wanted to know, hey, would you sort of put us at the head of the line if we get to the hospital? Because we are elderly, we are in that position. Should if we have any symptoms, should we just go ahead and show up at the urgent care or hospital? What do you want us to do? So that's sort of a broad brush question, but if you can answer that, I'd appreciate it.
Hey, Representative Stark, are you asking this to one of the hospitals?
Yes, either one of the hospitals or one of the people with the elderly affairs.
If anyone,
Representative Stark, this is Vice Mayor Geller. I think that both Memorial Healthcare and Baptist are referring to their telemedicine system because they specifically have not been wanting people to show up at the hospital, both for fear of overloading it and for fear of spreading infections. That's why they're asking the triage be done via telemedicine.
Yeah, it's just that a lot of these people, they don't know about telemedicine or are not set up for it.
right, Representative Stark, and I think that's why Ms. White made it clear that once they download the app, I think it walks them through understanding about telemedicine and makes it try to walk them through the process to make it easy for them so they can find out whether or not they are whether they need to come in or not. But what we can do is, Representative Stark, we can get with Ms. White to see how accessible this will be for individuals who are not prepared to or who do not understand telemedicine, and then maybe we can see if Andrea can connect you and Ms. White. Is that fair?
Yeah, let's not forget there are people out there that, as my mother calls it, a dumb phone. She doesn't have a smartphone, so that's that's part of what we got to think about.
Yeah,
I'm sure she's not the only one.
I agree. Thank you so much, Representative Stark. Now we're going to have Luby Navarro from Memorial. Luby, are you there?
Yes, I'm going to thank you. Good afternoon, everyone. I'm going to defer to Dr. Stan Mark, who's on the line.
Okay, Dr. Mark, you recognized.
Hey, good afternoon, everybody. Thank you for establishing this phone call. I'm not going to be duplicative about what has been already identified in terms of remote work and triage tents. I think everybody's aware we've got a number of tents up. Actually, I think all of our facilities now have triage tents with separate entryways for those folks with flu-like symptoms. We also have, thank you, Representative Geller, telemedicine is a key, I think, for all of
That
these.
was Vice Mayor Geller. Representative Geller is my brother.
I thank you both. And Memorial Doc Now is the application for Memorial. It is currently free through the month of March. So we encourage folks to use that. I agree with Baptist. It has been a real challenge. These telemedicine programs now have become somewhat overwhelmed, I think, for everybody. We are going to try to put some more physicians on board to answer these calls. I think the important piece that I wanted to articulate from Memorial is the great and cooperative relationship with the state and the governor's office, and to Shane Strom for being able to help us start this program in terms of drive-through testing, which we hope to have up and running by the end of this week. We are working collaboratively with the state, with the Florida Department of Law Enforcement, as well as the National Guard and the governor's office to get this up and running. There were a series of questions that were being asked in terms of would this be an open-ended testing component, and the answer to that is absolutely not. We are going to try to focus on the elderly population, so those folks over age 65. There are some provisos in terms of getting testing, and that involves a series of things that are already up on Department of Health websites that deals with symptoms that relate to fever, dry cough, shortness of breath, direct contact with a patient who is a confirmed COVID-19 patient, travel, either international travel, cruise travel, or known travel to known outbreaks within the United States. So those areas, unfortunately, are enlarging, but certainly we're well aware of New York City, which absolutely affects us here in Florida, Washington State, the Seattle area, and California. Those tests would likely be sent to a private partnership, Quest and or LabCorp. Those details are being worked out. The details of where this issue would be set up will be not on the Memorial Hospital West campus. I think it's important to note that we want to move these testing sites, as Gino spoke about, not on hospital sites. We don't want patients who either are asymptomatic or with low levels of illness on hospital campuses. It's not good for them, and it absolutely clogs up these already very crowded campuses. So this would be on a site that is south of Memorial West, that is pretty much at the intersection of Flamingo and Pines Boulevard. There is a shopping center there. It is not set up yet, so there is no reason for anybody to be showing up. I do believe that the National Guard, as well as FDLE representatives, will begin this work over the next several days to get us to be able to ramp this up. We do have an ability to test, and we have ramped our testing up. We, like Baptist, there is a need for a particular kind of reagent. I'm not sure that the conversation on this particular call, it's a fairly detailed issue of what kinds of reagents, but help from representatives from the governor's office are absolutely welcome to be able to get this particular reagent, which is from Roche Laboratories, to be able to ramp up our existing testing up into a pretty high level of testing. I agree with most folks that we are going to need more testing in Broward County, as frankly, as well as the rest of Florida and the rest of the country. I think an important message for everybody to understand is that it is absolutely imperative that the cities, the state, work together to decrease large community events or even relatively small community events. The whole notion of social distancing in this disease is going to be critically important to decrease the effects of this disease in our community. So I'm going to stop there and obviously entertain any questions from any of the folks.
Are there any members, representatives or senators who have any questions for Dr. Mark?
Doctor, this is Vice Chair Geller again. Same question that I had for Baptist, which is, again, you also said you're also out of reagents. Do you have any reason? I mean, if neither you nor Baptist have the reagents, which is necessary for the testing, I don't know how we're going to be doing any testing. Do you have any reason to believe that it will be coming in soon?
Well, I think what's going to be important is that Roche has reagent. I think they are shipping it to reference labs as opposed to hospitals. And I think that's the challenge. I think in this particular event, those hospitals that have the ability to test and have the devices and the platforms that already exist, Roche needs to be contacted to be able to allow us to get these reagents so that we can proceed with these tests. The particular platform that Roche has enables one to do large volumes of tests. I mean, we're talking about 1,000 to 4,000 tests per day. So it's pretty large volumes of tests. Our other device that we're currently using, the amount of tests that we're currently running on it are about 100. We believe we can ramp it up to about 400 with, we have to train some additional staff to be able to run this device 24/7. But with the Roche device, just because of the way it runs, it can run much larger volumes of tests for us in the system. And the goal here is to be able to help to run tests for those that don't have those tests up and running yet.
Dr. Mark, can I cut you just for 2 seconds really quick? Because Director Moskowitz just jumped on the call, and we need to get to him really quick because he needs to hop off a call to go speak with the governor. So can we come right back to you and start right where you are now, if possible?
Yes, sir.
Okay, Director Moskowitz, are you there?
Yeah, Jared's here. Yeah.
Go ahead, Jared. I'm trying to make sure. Just go, Jared. Take it away, man.
Okay. Sorry, I didn't mean to throw you off your game. It's not my fault.
I'm trying to be professional here.
Okay, sorry. Representative, thank you for inviting me to your call. So I want to go over some numbers, tell you also what we've been ordering. I want to talk about messaging, and I want to talk about where we're going from here. So in the state, we have 155 positive. We have 760 negative. That means we have results on 915 people, and it means that 16% of the people we are testing turn out to be positive. We are waiting on results from 568 tests. In Broward County, we have 38 positive. In Dade County, we have 23 positive. And in Palm Beach County, we have 8 positive. On the 38 positives that we have in Broward, only 2 are not travel related at this time. Let's talk about what I've been ordering. We've ordered from the federal government 5,000 ventilators, 5,000 cots, 1 million masks, 150,000 units of PPE each in the respective categories. So goggles, face shields, and Tyvek suits, and gloves, and booties, all those different categories. From private industry, we have ordered 2 million meals. We have ordered 2 million masks, and we have ordered all corresponding PPE as well. Again, hundreds of thousands in each category of gloves and booties, and face shields and masks and respirators. Additionally, we have secured a contract to help us produce 1,500 ventilators directly with the manufacturer. We have ordered 1,500 hospital beds as well. We have secured 2 250 mobile hospitals and 100 mobile hospital. These are field hospitals. And additionally, we have secured 100 nurses that are standing by that we are paying for every day so that we can surge into a hospital or help us run a field hospital. The purpose of that is that if we lose a couple floors in a hospital, or we lose a whole hospital, I can help pop up that hospital with a mobile field hospital. Or if they just burst at the seams, I can give them beds to increase capacity, but we have to increase outside. We can do that. As well. I want to talk about the Guard. We have mobilized the Guard to Broward County. They are right now in the ready position, waiting for a mission. They are working on a mobile testing facility, which I know you have heard, but I anticipate as this goes down the line, we'll have additional missions for the Guard in Broward County. I want to talk about messaging. If you can mute your line, by the way, that would be helpful to get some feedback. I want to talk about messaging. Whether it's right or not, this virus is affecting people who are 65 years or older, or people with underlying medical conditions far greater than anybody else. It's not right. It's not fair. And that's why you've seen us take actions like locking down the nursing homes, locking down the ALFs, locking down correction facilities. And that's not being done without compassion. It's being done
because of compassion, because the thing I'm most worried about in Florida is the grandkids going to see the grandparents. It's the folks that are asymptomatic going to visit people who, if they get sick, are going to wind up in the hospital, and then 5% of them will wind up in critical care. And so, while older people might feel picked on, their morale might be low. We're asking them to stay in. We're asking them not to go to restaurants. We're asking them not to go to casinos. We're asking them to social distance and not see their friends. We need to message to them that, look, these are temporary measures in order to protect them and keep them out of the hospital. And so I think we got to message that, because that's really who we're trying to protect. One last messaging point is that just because you test negative, that doesn't mean you're immune. It just means that you might be negative when you got tested. You could catch it. So as we test more and more people, and everyone's like, oh, I was negative. You're not negative forever. You were negative the time you got the test. That's an important thing. And so remember, on social distancing, you might be younger, you might be in good health, but you could be a hero by social distancing yourself from somebody else who is not in the same fortunate position. Last thing, protocols. I want to make sure you guys are putting protocols around yourselves. Continuity of government operations, you guys got to keep yourself healthy, okay? So please make sure that you're not hanging out with people who have traveled internationally or have been on cruises, or frankly, you should be increasing that to anybody who has been on domestic travel in the last 14 days. And that includes people in your household. Please make sure that they're refraining from doing those things, because that is your close contact circle. And with that, Chev, I can take one or two critical questions, but then I got to jump off the call.
Anybody from the media have a question? Maybe we'll take one question from the media and one question from a representative or senator.
Yeah, Director Moskowitz, how was your request for ventilators met by the White House? They're telling states to work on it themselves. Are you going to get the ventilators, and when do you think?
So I've been working on ventilators for weeks with private vendors, but the way this works with the federal government, just like in a hurricane, right? We buy stuff on our own, and we request what's called direct federal assistance. You always put it in the queue to get those requests in. These things are being manufactured, right? There aren't millions of ventilators just sitting in a warehouse. So as they get manufactured, they continue to come online, which is why we've done the private vendor strategy direct to the manufacturer and with the federal government. Next question.
Next question. Anybody?
Jared had a brain.
Sir, go ahead.
Yeah, you mentioned about travel, and a lot of the ones that we have here are from travel. If they traveled on a plane or on a cruise line and they've ended up here, have we tested the people that they traveled with, the cruises that they traveled with, or the planes they were on, or is it just we just kind of caught them?
So the answer is that the people that have been in close contact were put on isolation notices. That's what the health department has been working on. That's why contact tracing is so important. So if somebody tests positive and they were in close contact with people, we trace that, and then those people go on isolation, not quarantine, but isolation. And so that has been going on. I can take one more question.
One more question? Anyone?
Hey, Jared. Skylar Swisher with the Sun Sentinel. Is the state considering closing these casinos? It seems like an area where a lot of older people would be congregating. And as from what we've been saying, they're still open and people are still going there.
Skylar, that is an excellent question. I have been working with Secretary Beshears and the governor's office on a casino strategy. I think you'll be seeing something from us shortly.
All right. Thank you. Thank you, Jared.
Thank you, guys. Hey, you can call me on my cell phone if you got any critical questions. So if anybody's got some stuff going on in their city or in their district, just call me and I'll chase it down. Okay.
Thank you so much.
All right. See you soon.
Thank you. Dr. Mark. We're gonna go back to you, Dr. Mark. And I know you were speaking about the testing that you all have going on at Memorial Hospital, and I know there are some people who are concerned about them being under the age of 65, but they have severe respiratory problems, and they just got out of the hospital. How are the hospitals responding to these type of individuals who can't come out the house, but they do need the assistance, and they don't fall into that category over the age of 65.
Yeah, so anybody that's sick with a severe respiratory issue that believes that they may have been in contact with somebody with COVID or who has traveled, certainly if you're sick, you need to be either in an urgent care center or at a hospital. If you're not sick and you're asymptomatic, people who are not symptomatic there is no reason right now to test them. The only value in testing people who are asymptomatic is to see what the prevalence of the disease is in a particular community. Right now, that is not what is being recommended by the Department of Health in Florida, nor by the CDC. So that we are in a containment situation now in this country, and certainly in Broward County. So again, the whole notion of identifying people who are sick, regardless of age, sick and any other high-risk category, as I outlined before, should be tested. And patients who are sick who are not tested or who are not in this high-risk category should absolutely self-isolate. And the whole notion of social distancing and isolation, pursuant to a lot of the questions that have been asked, are totally appropriate. That's where we need to be headed.
Okay. Thank you. So, thank you, Dr. Mark. Do any member, senator or representative have a question for Dr. Mark? Okay, at this time, we're going to go ahead and, now that we still have some reps and senators on the call, is there anyone from the media who have questions?
I do for Dr. Mark.
Who's speaking?
This is Ben Connor from the Miami Herald. I'm so sorry. I just want to clarify. We've heard from Broward Health, or from Baptist Health, from Memorial Health, that they're running low in its reagent. Could the CEO of Baptist Health please clear up whether they are also running low in its reagent? Are they currently testing? Do they have the capacity to test, et cetera?
I think you had that. This is Gene Espentorio of Broward Health. I think you had that backwards. It was Baptist and Memorial that were talking about the reagents. Broward, we didn't comment on it yet, but I will comment now. So something that might help to clear this up, because it's pretty confusing, is there are various different machines, analyzers, as we call them in the industry, that are used as the hardware platform to test. And then what you put through that analyzer is called a reagent. So those are the testing kits, the reagents, right? So there's different types of analyzers that will test these kits. So, for example, the ones at Baptist, someone asked the question earlier of how are we testing at all if these reagents are low. The answer is because DOH has a different type of test, and LabQuest and Core and LabCore and Quest, another one. And I'm not sure what Baptist has, but for example, what Memorial has that they're running, that they're currently running on, is a Cobalt TechMan 3rd generation. So Broward Health, to answer your question in short, we are not testing today because we have a 2nd generation. However, the other 2 analyzers that we have, one of them is called a BioFire. The other one is called a Cepheid. I'm going to spell that because I get it wrong every time pronouncing it. It's CEPHEID. So both of those, the Cepheid and the BioFire, they're working on reagents to be available by mid to late April. And once those come out, we'll be able to run, so for example, on the Cepheid, we'll be able to run a test within 40 minutes. So I think ultimately there's a lot of different ways to test for this, and every facility is different. And I think the state's goal to get this to some of the facilities and private labs was to be able to expand the number of people that can do the test, but there's no one way to do the test. I'm not sure if that's helpful.
Thank you. This is Dawn White from Baptist Health. That was very helpful. I am not the CEO. And so what I would suggest are any questions from the media, please reach out to our communications office, or you can send me an email and I will forward it. I would like to clear one statement for the record, and that is that I think it was Representative Stark. If you have constituents that do not have smartphones, our Care on Demand app is available from our website, so they would need internet access, but it is available at the Baptist Health website, and again, it's Baptist Health Care on Demand. And we are sending that information to the delegation office as well.
Thank you so much for clearing that up, Ms. White. Someone has a question?
Yeah, Tony Pipitone here with NBC6 for Dr. Mark. Can you tell us what your capacity is in ICUs and your ventilator usage, and what sort of vacancy rate you may have now in those facilities?
We look every day at our ICUs, how many patients we have in each of our ICUs around the entire healthcare system. We look at the number of patients that are on ECMO. We look at our ventilators that are in the ICUs and how many vacancy slots we have related to ventilators. That is an issue that will vary on a day-to-day basis. I will tell you now that there are not a large number of hospitalized COVID-19 patients around Broward County, and not a lot of patients that are in the ICUs at this point in time. I think the challenge will be, as you watch the way things have developed in Washington State, for instance, and in New York State, there will be a surge. What Dr. Fauci from the National Institute of Allergy and Infectious Disease has talked about was blunting that surge. And that's the goal by all of these efforts that you heard Mr. Moskowitz speak about, and the things that we're all trying to advocate in terms of social distancing. And that will lower the surge to create this blunted curve, which then lowers the necessity for intensive care beds, hospital beds, if you will, and the use of ventilators. So I know I didn't give you a specific answer, and I didn't because that data changes moment to moment. If I gave you a number, it would have been this morning's number and not this afternoon's number. So
can we get a ballpark on what your capacity is?
No.
So Mr. Mark, just for clarity, because Memorial is in my district, so if you don't have, so you don't know if you have the capacity if you get an influx of COVID-19 patients, correct?
That's incorrect. I do know the exact capacity that I have. I'm just not. It is not of any value to report what the capacity is at this moment in time.
Okay.
I can tell you that we absolutely have capacity to take care of a large number of patients in our hospitals as well as in our intensive care units.
Gotcha. Okay. Are there any other questions from the media or from any members who have for anyone on the call?
Yeah, this is Steve Geller again.
Go ahead, Vice Mayor.
One of the two. Okay, thank you, sir. One of the two health districts, I don't know which one, mentioned that in terms of testing, that they didn't want to be testing any healthy people, or only people that were showing some symptoms. From what I've been reading, other countries have in fact been testing people that are healthy, trying to get a better handle on that. Do you anticipate, once we have sufficient reagents, that we will be testing more than just people that are symptomatic or at high risk?
This is Dr. Marks. What I would say, and this is based on what I have been hearing from the CDC, I do believe that as the testing kits and ability to test large volumes of people, I do believe that we will move to identify prevalence in communities. which is what is going on in other countries as you speak. So I do think that is going to happen as more and more tests come online around the country and, of course, here in Florida.
Thank you, Doctor.
Are there any other questions from the media or from any member of the legislature, representatives or senators?
I have a follow-up question.
How do we determine what is an essential service, or a state decision or a local decision as well?
Mr. Marks?
I'm not sure I completely understand the question.
If it's essential services, that's not a medical question.
You're talking about essential medical service?
Yes, correct. So if the state determines that, for example, pharmacies and groceries are essential services, in addition to others, would the counties and then cities have the discretion to narrow that? And would they, I guess is my question.
This is Dr. Marks. I don't think that's in my wheelhouse.
I do have a question that pertains to testing. We've now heard from all three hospitals, and I apologize for just it's a little hard to follow who's speaking and when. But so as I understand it, just to recap, the only of Broward Health, Memorial, and Baptist Health South Florida, Memorial is the only one of those hospitals that's currently doing testing on its own. Now, I imagine all hospitals are able to send specimens to state DOH labs, but I just want to hear a little bit more about how that process has worked. Have you been running into issues? I know we heard here in Jackson that doctors and nurses were asking for tests and not getting them. Could you just speak a little bit about your access to testing outside the hospital?
I'm sorry, can I just jump in? This is Gino Santorio, Broward Health. Could I just ask the media to please confirm with our hospital facilities prior to attributing statements to the organization? I just saw a tweet come out about Broward Health not being able to test because it doesn't have the reagents. That is the wrong attribution. So I just want to make sure it's right when it comes out, please.
I would echo that request, please. This is Dawn White from Baptist Health.
Did you not tell us that you didn't have the reagent and weren't testing at Broward Health?
Broward Health doesn't even have the machine. So it's not a matter of not being able to have the reagent. We don't have the current machine for it.
Okay.
And there are multiple uses of the word testing. So what's really important, if you would please, this is Dawn White, contact our media communications. You know who they are, and use that resource so that we're appropriately informing the community. Please.
Thank you.
This is Memorial. I'd echo the same issue in terms of other than comments that I'm making, which are all open, and I stand by them. I do believe any other issues, please call media relations. Thank you.
Thank you, Dr. Marks. Are there any other questions? Thank you all so much.
Can we get an answer to the
Oh, sorry. Go ahead.
about
Sorry.
the testing?
Testing.
Can you rephrase this, Gino Santorio, Broward Health? Can you rephrase that? If I can answer it, I'm happy to.
Yes, I'm sorry. And I apologize for the confusion. So a lot of people are wondering why they can't get tested, what the capacity is. We've heard conflicting information from the state. We've heard here at Jackson that doctors and nurses have not had access to testing through the state labs. So I just want to clarify what that level of access is at Broward hospitals. If you've had trouble getting people tested, if you're getting everyone tested, you feel you need to be getting tested, et cetera.
Got it. So we have not had trouble getting people tested that we feel need to get tested. However, that answer may be a little bit limited in terms of the what it means, simply because we're only swabbing and sending the test out at this point. We send them to 2 commercial labs as well as the Department of Health. So we haven't had an issue on our end, and we're able to get the results back. Insofar as the capacity of the actual testing centers, I wouldn't be able to speak to that.
So
I'm sorry. Go ahead.
Dr. Marks, let me, and Gino is absolutely correct, and I would also reiterate that Memorial has not had any issues in terms of working with the Department of Health in obtaining testing that has been indicated. Now, I think what has happened is there has been a lot of confusion about what tests are indicated. And the CDC and the Florida Department of Health, and they are absolutely in lockstep in terms of what their recommendations are and what they will test. And, I'm not going to go into details on what those indications are, but they are very specific. So that a physician out in the community, for instance, might want a particular patient tested, but it doesn't meet a particular standard to get the test done. So that whether the test is done in a Department of Health laboratory or whether it's done right now at Memorial's laboratory, we have to adhere to that exact same standard. So I just wanted everybody to understand that that's an important component. There are very specific guidelines as to what can be tested right now, both in the Department of Health laboratories here in Florida and at the CDC in Atlanta, and by us or anybody else for that matter that's going to be running these studies. So I think that may be part of this confusion that has been out there in the community. I hope that helps.
Thank you so much, Dr. Marks. And I just have one question for anyone who could answer it, and then we could end it. Someone is asking about is it purely coincidental that Broward is disproportionately affected in South Florida? Can anyone speak to why the case loads are so high in Broward? Is anyone qualified to speak about that?
This is Vice Mayor Geller. I can answer that.
Okay, go ahead, Vice Mayor.
It's because Port Everglades.
Port Everglades. Okay.
Right. A lot of the initial cluster came in at Port Everglades, and that's the reason Broward is disproportionately affected. I can also answer the question that somebody asked earlier to one of the doctors, although it wasn't really a medical question, of what is essential personnel. And the answer is that local governments do have the ability to reach that determination, just like the county is not going to be doing, presumably, at least as of now, any county-wide quarantine or anything like that, because 98% of the county is within municipalities, and thus far, at least, where the county has determined that the municipalities should be making these decisions on a municipality by municipality issue, and I presume, presumptively, since they have the ability to make that decision, that would also include what is essential personnel.
Thank you. All right. Thank you all so much.
Representative Jones?
Yes?
This is Gino. Can I, do you mind if I just clarify?
Please, go ahead, clarify. Absolutely, Gino. Go ahead.
We're talking about the ability to test, and I want to make sure that people out there in the community understand that there is a big difference between us testing patients at Broward Health, which we've tested over 100 that have come in, we've swabbed them and been able to get the information back to them. There's a difference between us actually inputting that specimen into an analyzer here on site and confirming the test and sending it out. Hospitals outside of COVID-19 all the time send tests out. We collect the specimen, we send it out, we get it done, it comes back, and we report it. So the ability to test can mean a lot of different things. I want to make sure the community understands that if they show up here, they will get tested.
And Gino, what's the turnaround time of the test?
So it depends on what it is. Right now, LabCorp and Quest are running about 3 to 4 days in terms of the test. But I want to make sure people understand that there is an ability to get tested at Broward Health, and we've actually had no issues getting those tests done, turned around, and resulted. It's just a matter of, are we physically conducting the test in our lab analyzer today?
Gotcha.
And that's really not germane to COVID-19. That's just hospital industry. That's how it works.
Okay. Thank you, Gino, for clarifying that. Well, thank you all for hopping on the call, to Gino, to Don, and Luby, to Director Moskowitz. We really appreciate you all, and I know you all have a lot on your plates, but I thank you all for the update. We really appreciate it. Thank you.
And Chairman Jones, thank you for doing this call.
Oh, thank you so much, Vice Mayor Geller, for jumping on. Really appreciate you. Everyone have a good day. Bye-bye. Thank you all so much.